uh, PAPH, or the People's Alliance for Public Health, have been vocal about the public health bill, the draft of which can be tabled, possibly tabled in the upcoming monsoon session, and its correlation with the WHO Pandemic Treaty, the World Health Organization Pandemic Treaty that has been signed in 2022. And in this connection, today we have with us Dr. Maya Valecha. She is a doctor and a social activist from Gujarat, and we have a few questions for her. So, over to Dr. Valecha. Our first question to you is that we know that you are a strong dissent in your state, and you have also become one of the pioneers in bringing out in the open the new designs of the state and the multinational corporates in bringing down restrictions on the people and curbing their freedom. In your opinion, is the new public health bill really going to be tabled in Parliament this monsoon session?
That's what our democracy is all about, that we don't know, right? So first thing, it by itself, what the government has done till now for most of the bills is that it either does not discuss enough, give enough time to the public to discuss the bills, either it's neither shown to the public in most cases, it's not discussed even in the parliament enough, and just passed by sheer majority. So we are not in a white. That's how we are now alarmed that government is coming up with such a draconian bill, and with sheer majority and the way the record is, they are likely to pass it also. If they will not bring it in monsoon session, they will bring it at some later stage, but they will bring, that appears quite obvious.
Do you think that if it is tabled in this session, will it be in the same design as it was in 2017, or will it take a new avatar?
See, what we know everything from media reports, right? So what media has said it, that such a draft was tabled in 2017. Yes, it was tabled. We have that draft. Plus, what media has said is that lockdown will be now more defined, because this time there was chaos. When to declare, how to declare this. As such, our opposition is to the lockdown itself, but they want to make it more defined now. So that will be more draconian. Second thing they have said is they will force categories of duties. What it basically means is centralization of power. That whatever the center says will have, as we know, as we will discuss further down, that what all was there in 2017 bill. From that, we now know that it will be more centralization and less of, local, or say our original concept of Panchayati Raj, or what we demand decentralization, it will be exactly opposite of it. That's what we gather.
Since we are discussing about the bill itself, so my next question is that what is your opinion about what is draconian about this bill? Why is this bill so draconian? And as we have known from the draft bill of 2017, why we should not let it get passed in the parliament?
There are many things which are absolutely, objectionable, which I'll tell you in detail. And second thing, it doesn't talk about public health. Under the title which it is, it doesn't talk about public health. What it says, that's our first objection, that public health needs attention in our country, and such a bill was brought in 2009, which was never pushed further, which encompasses the whole aspect, I mean, total aspect of our lives, right from jobs to housing to nutrition, everything. And such a thing can be encompassed in a public health bill is, I mean, there's a precedent of it. But that thing is not being done, and instead only virus, bacteria, and bioterrorism, which are not the major, because in our country 2500 children are dying of malnutrition related diseases daily. I'm telling, 14 around 1400 people are dying daily of tuberculosis. So these things are more, everything again related to insecurity, social, economical insecurity. So instead, this virus, bacteria, in that also, see, first and foremost, it what it says is, when this bill will be in operation, that according to this bill, when they will declare emergency, all other rights will be overridden. That means our fundamental rights of right to speech, right to life and liberty, right to going to the judiciary, all those will be overridden. This is a, I mean, direct emergency declaration, right? Second objectionable thing is that not only the number of cases when happening, but even the likelihood of it, that any officer from district level to the central level when feels, and we know there's no transparency, we know from this corona episode that without having any emergency, they declare emergency use authorization, they start rollout of vaccine, when even our experts are denying, they do everything. So it's the officer, what officer, at whose advice, nothing is defined. What they can declare all the emergency measures, and in these emergency measures they can enter our houses, they can enter our premises, they can do testing, they can give medication, even by order vaccination can be done, is written by order. They can destroy our, whatever animal life people are having their so these are when they can close schools, they can close markets, they can seal buildings. So this is nothing but an what I would say authoritarian rule to suppress some people. In case of, suppose you are opposing for something and you are to be targeted, your building can be sealed. We are suspicious that something is being done here, and that will be now even no political. You can be said you are now having, this building is having some biomedical hazard. So this is very. Third thing is, it is clearly mentioned that when WHO declares emergency, now we know WHO, it has changed the definition of pandemic in 2009 just to declare swine flu. After swine flu, because there were maybe some honest people were still left, even our media had reported, because it was full inquiry was done by European Council, and it was proved at that time that WHO is working under the influence of pharma mafia for their interest, and governments world over colluded with them. So these are known things. And why we say this bill is because it's written in the bill that but nowhere it is written that when WHO declares, our local experts will review it, see the condition of our country. They should have written at least that much, that then we will review what's the condition in our country, right? So there are other things which we will discuss further, but these are the three basic things which have to be opposed vehemently. And lockdown, we will come to it if you have anything to ask in between.
You have discussed about the totalitarian character of the bill, and also about the WHO pandemic treaty. So is there any correlation between the WHO pandemic treaty and the bill? Because the bill was actually written in 2017. The draft was made in 2017, and the treaty has been passed in 2022. But if we read the bill, it seems as if the bill is actually following the recommendations of the treaty. So what is your take on this?
See, WHO treaty is so far just proposed. It's not so far passed. It will, I mean, unless they call for a emergency meeting, like now there's a big pandemic and we have to pass this treaty or some, they can create anything because they had an emergency meeting of World Assembly in last year. So they can do that. But so far it is in the proposal stage. But international health regulation, which were already in place, they are there since 2005. And in that also it's written that every country has to pass laws in their country, to suit these international health regulations. They wanted amendment, make it more stringent, which has also failed. But now behind the doors they can come up with more at WHO level, and to be prepared for that. So parallel things are going. They could not pass in 2017 because there was no corona episode, they had not created that time. Now they are sure that they can pass this bill because they have scared the people. Nobody will oppose, nobody will actually expose. Yes, there are so many people like us who are exposing corona, and we will have to continue and expose the things that how corona episode was also a scam, and further repetition of such things is planned through this bill and through this treaty. And the way it's not according to the need and priorities of the country, and there's a mention of WHO, it's very obvious that it's not for our health, it's not for our country's public health, it's for WHO.
So you have mentioned that the bill deals with restricting the people's lives and livelihoods, even as individuals and also as communities. So do you think that this is fascistic?
See, it's fascistic in that sense that, during this episode also, there were slogans like you remain isolated and you check if others are also remaining so. You wear masks and also check whether others. So this is fascism. You are creating enmity in between the people, thinking that other person is a threat to me and the other person, so that way our unity is being destroyed. That is one way of fascism, that you destroy the unity of the people, make them think irrational things by sheer propaganda, but that this is harmful to you, that is harmful to you, the way it was done for religion in past. Now they are doing on health grounds, that this is harmful, and all those who are doing this will be harmful to you, and you become enemies of each other. So that part is fascism. Other things are authoritarian, it will destroy the life directly. The way I said, we have, as you know already, Jan Andolan has written a letter, and by now more than 3,500 signatures of prominent people, in the sense doctors, lawyers, those who are like you and me, active people in the social life, have signed this letter. In that major one full part is covered for lockdown, because that destroys social life, economic life. Our immunity is also affected by lockdown. Pure medical reasons. Asocialization by itself decreases immunity. Your economic, social insecurity, throughout they are scaring you. These things do decrease our immunity. So lockdown, and during the 1956-57 influenza episode, WHO itself had refused lockdowns because simple lockdowns don't prevent virus. First of all, there's nothing to prevent. Corona was not such a deadly virus by any means. By now, government also explains, accepts that no extra deaths were found in 2020. Then what for you had, tortured people for the whole year, right? You didn't, if it was a decentralized local managed, people would have said that no, there's nothing around us, right? How they created those pictures only on TV and media is a different. So lockdown is one big thing that we have to oppose, because one thing, it doesn't stop. If even if there's a real deadly virus, lockdowns don't stop. In our own country, within 2 months of lockdown, more than a crore people showed antibodies. Where did they get it from? One thing, our people never followed lockdown. Let me tell you, except few urban pockets,
Hmm.
nobody followed lockdown, nobody follows masks, and that's why we are safe. You get exposed to virus, you get antibodies, and you're fine. That's what is the cycle was all throughout human life. And they are now turning it upside down by scaring you, by giving all unscientific measures to be taken, which actually destructs and destroys our life.
In connection with what you have said, the bill deals with authorizing any officer or person even in entering any premises and conduct search, disinfection, destruction of properties, and so on. So, do you think that such provisions in the bill can be used as narrow vendettas against the opposition or any community or individual?
Yes, that's what I said. It not only targets, but you know what what other provision is there? If that a particular officer, if he is advised from above, we know who is above and who will advise such things. If he doesn't follow that advice of doing all these things, he can also be sued. Actions can be taken on him. So even if the officer locally feels that no, there's nothing is required for this particular area, this particular community, or this particular person, he will do it for his own survival. That provision is also there, that such officers will be taken action against. So it's a totally authoritarian, and yes, there's a 100% risk of, because we have seen on ground, with any and every law with loopholes is used against people which you enumerated, that if they are in opposition, if they are saying right things. So all such provisions in the bill will be used against opposition or community or persons.
So, whenever we ask questions, like against the media or against the ideas of the pharma multinationals and what they're trying to do, a question of common good is being perpetrated, that we have to do it for the common good and so on. This is what they tell us. So whenever they try to exercise the COVID vaccine on everyone, they say it's for the common good. And even when they endanger lives of various communities, they also say it's for the common good. So how do you think that it is possible for us to fight such lies and half truths?
There are two ways. One thing, we have to show them their hypocrisy, that there are many things for common good which they are not doing. Like what I would say, just 2 days back, I have tweeted also that plastic has reached even our bloodstream. Why don't you ban, such whatever minute use of plastic is there in some plastic surgery or some, heart surgery or certain places. Why don't you limit it? Why have you allowed this? Why do you allow tobacco industries? Why? So that is one thing. First, their hypocrisy. Secondly, our fundamental right to our body, our bodily integrity is there in our constitution. Right? And all that they have, last Supreme Court judgment is somewhat considering this particular point, that yes, bodily integrity, it has again said that if the common good is, then the government may, but it is, we will have to be continuously vigilant that this particular vaccine at least doesn't do any common good. It does not prevent infection, it does not prevent transmission, it doesn't do anything. First of all, you prove that this disease is so deadly, apart from your wrong figures, with We have written in the our letter to Prime Minister this also, that RT-PCR test, which is not an approved, it is also an emergency use authorized, which has its own so many loopholes apart from cycles, which they have approved, which gives so many false positive. A test with 85 to 95% giving positive in asymptomatic patients. I mean, you can't use the word, sorry, asymptomatic persons. You can't call, but they are calling it patients, right? So many things are. If you allow me, I'll give our leaflet also. You must have written that ultimately we can't give our vital sectors in these private hands. They will come out with, see, media is there, so they will come out with anything which will say that this now endangers the public good. So certain vital sectors like health, education, even communication, they are bringing 5G without any public safety studies. Similarly, media, which has to be, publicly owned and managed publicly. So far, what we have seen, public sector means managed by the government. No, public sector should be managed by public. Now, with all the advancement in IT technology and everything, I have given the full blueprint how we can manage certain sectors directly by participatory democracy, from small units to the highest levels. So these are the ultimate solution. But right now we have to continuously expose their wrong things, that what you are saying public good is not actually for public good. You are saying vaccine for public good, which is not doing any public. It's not stopping infection. It's not stopping. Now, according to latest studies and those vaccinated countries, wherever the vaccination is more, actually the hospitalization and deaths are more. So it's not even helping you by itself, let alone the public. So this vaccine is not a vaccine at all. And vaccines were usually used for serious diseases, say tetanus, say where the death rate is high, where there's no proper treatment. Whereas this is a mild virus for which most of our people, and in one of the study it is said this 99.5% of the world population, I'm telling you, have the memory of previous coronavirus, and they are responding from that. That means we are all immune. These things are hidden by popular media, and they are just saying that it's a deadly, everywhere in media any report deadly virus, which is not deadly at all. So we have to expose these things continuously, and along with that, a parallel movement to own the whatever vital sectors are there should be owned and managed by people. Direct participatory democracy. That's what is my ultimate suggestion.
So we have come to the last section of this interview. Ma'am, the bill actually intends to subject the question of health under the direct control of the union government. So do you think that the bill will destroy the federal structure of our constitution?
Yes, anytime if they feel that this state, the way I said, not only officer, if a state is not acting according to their direction, they can directly take over. Now, you are saying centralization, the WHO treaty itself also is like that if a country is it seems to the WHO that it's unable to manage the pandemic. Now, it's all according to their whims and fancy. Then they can take over the country's health management. Similarly, center, if feels that the particular state is not managing properly means according to their means. Right now, there's no emergency, still vaccination is going on. What for? Right? So they can take over the state's health management. Now, with health management, it will be police control. With police control, it will be all other, like a corporation is managing health. So our corporation, your finance, where to use your finance, whether state's finance, where to use, that will be now decided by center. So these are the things. It will be a total centralized power, and of course destruction of our federal structure.
So, my last question to you is that in order to fight against the passing of this bill in the parliament, what can we do? What can we activists actually do in this regard?
See, we just before some time, I mean, when we were also writing this letter to Prime Minister, we had thought of, and in fact, we have sent this letter to many, like all chief ministers, that because state health is a state subject, you oppose this. Nobody answers. Number one. I have written to the Parliamentary Standing Committee President, I mean chairperson, and some members that this health bill is coming. Please, nobody answers. Health Minister also, Chief Justice of India, everybody we have written. I mean, we thought of going to the local MLAs or MPs, but we know with sheer majority, and most MPs, MLAs don't think. They simply do whatever their leader says. They are there only to collect votes, and whatever financial benefits during the course of their tenure they can have, they will take it. This is the we started with lack of democracy, and this is what now our democracy. We need participatory democracy. So we will have to go to the people. And let me tell you, one small 2-page leaflet which I have written, and it is translated now in Bengali, it is Telugu, Hindi, Gujarati, and English. These 5 languages it is available. People from Odisha, then Tamil Nadu, and one state, they have said they will also translate. And let's see, people on their own have started distributing, printing this leaflet. We are simply doing a slow, what I would say, revolution, that people should be aware on 2 things, that government is bringing such a bill, and number 2, we can't depend on these people now. We have to be public participation of in all the things that are relevant to our lives, and everything is relevant to our lives, whether this should be produced, whether that should be produced, whether there's a real epidemic, people can see how many people around me are affected, how many people in my village. We have visited villages, people say nobody. Some people died, they themselves were telling that yes, after hospitalization, out of sheer fear. And this is also medically proved, that anxiety disorders can kill the person. In corona, it has been proved that because of anxiety, a person can die. Such studies, which is so common knowledge, but now everything has to be proved with studies. So going to the people, awakening people, it's a long route, but sure route. Going to courts or going to MPs and MLAs might sound short route, but in the long run, they may turn on any side and it may not work. We can always, on the side by side, we can do those things. But sure and long-term solution is going to people and awakening people. That's the only way.
So, many thanks to Dr. Valecha. We will keep in mind your words about going to the people, and we are in solidarity with your work. People's Alliance for Public Health is in solidarity with your work, and we should find out more routes to work in consonance throughout the country. Thank you.
Okay, my pleasure to be with you, to come in contact with you, and to talk to you. And yes, future we will join hands for many things. Okay, thank you.
Thank you.